thinking about social work in particular, what is the role of case management in social work to support people who are experiencing homelessness?
Social workers, after your completion of your degree program, always go to the field and they become case managers, right? Why are they case managers? Because they are managing cases. And I always tell my students that managing cases is about you looking at reviewing the presenting issues that are associated with the cases. And I will tell my students that if a file comes to your attention, right, and you just look at the file and they have stated some issues, social problems with the file, or your clients come to you and the clients tell you, oh, I couldn't sleep last night. I have a headache. I think I'm depressed. Those are presenting problems, or what we call presenting issues. Now, it is our responsibilities as case managers to do our own assessment, right? And then using the client's story, you and the clients together will be able to come out of a better understanding. This is how the issue looks like, right? An issue is then you are formulating the issue. It's just like a medical doctor coming out of diagnosis. So you are formulating that issue together with your client. So that is the starting point of case management. Trying to engage is about engaging with your client. If you don't engage with your client very well, you are not able to get your client to tell you everything. Engaging means establishing rapport, that therapeutic alliance relationship with your client, being there for your client, genuine care, warmth. People say this just, they pay lip services to that, but you have to express it genuinely for your client to really understand that. So the first element is that case management is engagement. The second one is assessment, where you collaborate with your client and come out detailed assessment. And from that, you formulate issue that is being presented to you, right? And then jointly, you develop an intervention. The beauty of the case management is that developing intervention is that you are not doing alone. In the past, so many years ago, social workers believe that they are the case managers and therefore they know so much better than the clients. So they would just be like an expert in the field, tell the client that this is your issue, this is your problem, this is what you need to do. This is why you are homeless, because I think you're having a lot of drug addiction issues that makes you homeless, right? But your client has come to you, maybe he's having addiction issues. There's an underlying situation, the microstructures, the meso, the ecological system that I talked to you, that is underlying the clients, influencing and pushing clients to be addicted, and thereby the client become homeless. So therefore, you are not going to define the problem as the addiction is causing the homelessness. You are going to find why the client is being addicted, right? You are looking at deeper meaning behind people's situation. That makes you a case manager. And once you do that, you are not, my father would say, you are not a recluse. Recluse is somebody who is able to put the whole world on their shoulders and solve the problems. You are not recluse. You are not a Superman, right? Your job is to look at the situation, look for resources. That makes you a case manager. Looking for resources, organizing those support and resources for your client. And how do you do that? You do that by referring. That is why in my community class, I want my students to identify and assess all community resources. And when I talk about community resources, I'm looking at the social resources, and I bring that in my social policy class. And those resources are the ones that you are connecting your clients to. If a homeless young adult comes to you, what are the resources that will be able to mitigate that negative aspect of homelessness? And I always help my students to understand that that is the essence of a case manager. You engage, you assess, you formulate together with your client to formulate the situation about homelessness, have a better understanding, and then together with your client, you develop an intervention plan. And your role, which is probably beyond the control of the client, is to be able to look for resources for the client. And one of the principal components of this is referral to legal resources, medical resources, health resources, educational resources, housing resources, housing first. What are you? And this is where you need to step up to become an advocate, because then your clients don't see you. I always tell my students that our clients don't see us as helping professionals. They've come to us for help, right? Even though we're supposed to empower them to help them, for them to help themselves, but you also have to step up, helping your client to negotiate, advocate for resources, organizing some resources and support for your client. And that makes you a case manager as a social worker.